Hey, this is Doug Field, CEO of the Institute, and welcome back to this segment of Healthcare Consumerism Radio. And we have one of our association and think tank partners on the line right now. We have Erica Mobley, who is Membership and Communication Manager with the Leapfrog Group out of Washington. Good morning, Erica.
Good morning. Thank you for having me.
We're doing fine. How are you doing?
Doing well, thank you.
Good. Well, nice to have you here with us. Talk to our audience a little bit about, what the Leapfrog Group does, and then we'll get specifically into your hospital safety score. But tell us about the organization, and then let's talk about the safety score as well.
Sure. The Leapfrog Group is a national nonprofit. We were formed about 13 years ago by a group of large employers who realized that they were spending hundreds of thousands or millions on their employees' health care benefits, specifically in hospitals, and they had no real way of determining if that care that their employees were getting was any good. This came on the heels of the 1999 Institute of Medicine report, To Err is Human. And these employers were really concerned about the high rates of errors and mistakes in hospitals. So they created the Leapfrog Group to try to use employer purchasing power to catalyze giant leaps forward in the safety and quality of healthcare in hospitals. And so with that, they created the flagship Leapfrog Hospital Survey. This is an annual survey that hospitals can voluntarily complete. It looks at a wide variety of patient safety and quality practices, looking at how patients fare. And then our employer members use this information in contracting with their health plans and in benefit plan design to try to steer their employees towards the highest quality and the safest hospitals. Therefore, not only protecting their employees and helping them get the best care, but also saving the employer money in the long run as well.
Erica, do you need to be a member to access this safety score study?
No, not at all.
Okay.
All of our data is published on our website. We report results from the Leapfrog Hospital Survey on www.leapfroggroup.org. And then we also have a separate initiative called the Hospital Safety Score. This looks specifically at how well hospitals protect patients from accidents, harm, and error. And that's at hospitalsafetyscore.org. And both are available completely free to the public.
Erica, I know a lot of what we talk about here at the Institute for Healthcare Consumerism is really empowering an employer, really empowering their employee population to make better choices around their health and healthcare benefits. With your hospital score, how can employers help their employees understand how to utilize that hospital safety score?
Yeah, well, we created the hospital safety score with the consumer in mind. We wanted something that was very easy and understandable to anyone. And so the hospital safety score is a letter grade, A, B, C, D, F, a system that everyone understands from going through school. And an employer can use this to educate their employees that, first of all, employees do have a choice when it comes to their hospital, and they should be proactive in making the choice that's best for them. And then secondly, that not all hospitals are the same, and some hospitals really do have a very poor patient safety record, and this is something that employees should consider before choosing a hospital. So we really encourage anyone to take a look at the hospital safety score, regardless of whether you're going to the hospital for stitches or open heart surgery. Safety is something that's important no matter what. And so it's the first thing that somebody should consider before going to a hospital. Employers can direct their employees to our website, or we also have a free mobile app that's available for Apple and Android devices.
Oh, you do? Okay.
And people can use this to find the safety of hospitals in their community. And then if they determine that they're not happy with the safety grade that their hospital received, they can use that to start a conversation with their doctor or hospital administrators and ask what that doctor and what that hospital is going to do to make sure that they stay safe while they're at the hospital.
How does this compare to some of the other ratings that are out there, like U.S. News and World Report does this and HealthGrade does it? I mean, I'm not saying they do what you do. So what's the differentiator? What do you do differently?
So what's different about the hospital safety score is that it looks only at safety. Mm-hmm. So what's the hospital doing to prevent errors? For example, do they have a hand washing policy?
Okay.
Do they have a computerized medication order entry to help prevent errors? And then also, what's the hospital's rating of some or history of some really awful and what we call never events in healthcare? Like how often have they left an instrument inside a patient after surgery, or how often have they had an air embolism?
That's pretty scary stuff, Eric, quite frankly.
Very scary stuff that you hope never happens in a hospital, and that an employer certainly hopes never happens to an employee. But so we're looking only at safety. We're not assessing how well a hospital performs a knee replacement procedure or how well they treat cancer. This is just looking at safety, which differentiates it from some of the other ratings that are out there, which are also good and also important to consider. But as I had mentioned, we think that safety should come first.
Yeah. So you thrive regardless of all this data that's coming out from all these hospitals, because your distinct niche is that safety niche, correct? As you're saying, okay. Now, what do consumers do if there are no hospitals like with an A grade within a reasonable distance? What do you make recommendations, or you just provide the safety score?
Well, first of all, if it's an emergency or it's an urgent situation, it's important that people get to the closest hospital as quickly as possible, regardless of what that hospital safety score is. So we want to make sure that people know that a low grade doesn't mean absolutely avoid this hospital. But we do want people to realize that errors do happen far too frequently in hospitals, and that even if you're going to a hospital with an A grade, mistakes still can happen, and it's really important for people to be vigilant and take steps to protect themselves while in the hospital. So on our website and on our app, we have a list of things that we suggest people do while they're in the hospital. For example, bring a family member with you when possible to help pay attention when you may not be as alert. Make sure that you're writing down all your questions so that when you do get time with your doctor, you'll remember those questions and have the opportunity to ask them. So even if going to an A hospital is not an option for somebody, we encourage them to use the safety score to start a conversation with their doctor to talk about safety practices and make sure that that doctor and those hospital staff are taking steps to help that hospital improve and help the patient stay safe while they're there.
So the value proposition back to employers, one certainly is to make sure that they're providing their employee consumers with, these decision support tools. And I'm assuming the second very clear one is it is a cost-saving benefit to employers if they can help prevent their employees, from having to deal with any of the serious consequences of an unsafe environment.
Absolutely. We're actually in the final stages of developing a cost calculator that employers are going to be able to use to tell what the estimated added costs they pay for an employee who's going to a hospital rated below an A. So we're really excited to be able to offer this tool to employers, and that certainly something we'll be able to share with the Institute for Healthcare and Consumerism, but not only in terms of the direct costs that they're paying to the hospital, but also in terms of lost employee productivity, increased time out of work, if an employee experiences complications while they're in the hospital, resulting in an infection, a longer hospital stay, or anything that may prevent the stay from going as according to plan.
Now, when will that be available, Erica, the cost calculator?
We're hoping that it'll be available sometime in early June.
Excellent.
We're going to have a white paper as well as an actual calculator that employers can use to figure out what we're calling it a hazard tax. So the added costs that they pay when an employee would experience an error at a lower graded hospital.
Yeah, we look forward to working with you to provide that to our members.
Now, Eric, I got one question. Now, we're based here in Atlanta, and we've got it's a big metropolitan city, and you're in Washington, so we have you're in D.C., so we have access to some pretty good quality, hospitals that are in close vicinity to us. But I'm assuming there's better hospitals in certain areas versus other areas, and how does an employer I think you kind of answered this in the last question, but if I don't have very close access to a high-scoring hospital, then what are kind of my options? Is it, I have to go, make the drive to get to a better hospital? Is that kind of my option?
In some cases, when it's a procedure or something that is planned, that's when we would really encourage employers to consult the safety score, and if it is a very serious and very planned and ahead procedure, that it may be worth taking the time and the extra effort to go to a hospital that is much further away. But in an emergency, it is most important to get to the closest hospital, regardless of their grade. And we certainly don't want employers to be telling employees to absolutely not go to a hospital, but just to use this as an education tool that hospitals are not all the same, that mistakes happen in hospitals, and that employees should be very aware while they're there and taking whatever precautions they can to protect themselves.
Now, give our audience a little bit of an idea of how what data points are aggregated together to give the outcome of a specific score for a specific hospital.
Sure. Well, we worked with a panel of patient safety experts. These are people who are at the top of their field from institutions like Harvard and Johns Hopkins and Stanford. And they took a look at all of the publicly available data related to hospital safety, every measure that existed out there in the universe. And then they determined that there were 26 measures that they felt were the most reliable and most significant factors influencing how safe a hospital is for patients. So they took these measures and then put them into a scoring algorithm. So we collect the data primarily from Medicare. Hospitals have to submit claims for Medicare and then report on a number of different measures, and then Medicare reports that data out, and we use that data. We also use data from the Leapfrog Hospital Survey for hospitals that have completed the survey, and we have that available. And then we use some secondary data sources, such as the American Hospital Association's annual survey and a few other items. So we take all of the data and plug it into this complex scoring algorithm to come up with a composite score, which is then translated into the letter grade. And if a hospital doesn't have a certain data point available, we don't penalize them for that. We just reweight the other measures to make sure everyone is given as much credit as possible towards their score.
That's excellent. Well, Erica, listen, as they say, time flies when we're having fun. We got about 2 minutes to go, and I'd like to give you kind of an opportunity to kind of wrap this up and give our audience some clear takeaways about, Leapfrog Group and the hospital safety score.
Sure. Well, I'd just like to stress that we are an employer-focused group. We work with lots of employers all over the country, and we're always looking for new members. We are trying to provide those members with tools that can help them better educate their employees to result in safer, happier employees and, of course, decreased costs for the employer as well. All of our tools are available for free on our website, leapfroggroup.org, hospitalsafetyscore.org, as well as our mobile app. And we would encourage employers to use these to start having a conversation with their employees about the importance of high-quality and safe hospital care, and use our ratings as one source of information to choose a hospital. We have lots of resources available. As I mentioned, we'd be happy to work with any employer and any of your members to share more of that information and let them know everything we have available.
Well, Erica, listen, I really appreciate you joining us today, and thank you for your time. And to our audience also, you can find Leapfrog Group front and center on the Institute site as well. And we're very happy to have a good relationship with Leapfrog Group. But you have a great weekend, Erica.
Absolutely. Thank you so much.
Thank you. And to our audience, stay tuned for the next segment of Healthcare Consumerism Radio.
Healthcare Consumerism Radio. Learn, connect, share. Join us every Friday at 11 o'clock to learn all those confusing issues around healthcare, Obamacare, Medicare, Medicaid.